Good morning once again, everyone, and welcome to our viewing and listening audience to this, the 28th meeting of the Joint Select Committee on Social Services and Public Administration. This meeting is being broadcast live and, of course, online at ParlView. It's pursuant to the examination of the current level of childhood obesity and the state's interventions to promote a healthy lifestyle among children. We advise our viewers and listeners also that they can submit their comments and questions to the Parliament's social media platforms. Thank you all for joining us this morning once again. At this time, I'd like to invite members of the committee, our committee, to introduce themselves, starting with a member on my right.
John Twain, member.
Glenda Jennings-Smith, member.
Good morning all. Esmond Ford, Vice Chairman of the committee.
Good morning. My name is Christine Nualo Hossain, member.
Good morning. Alison West, member.
Good morning. My name is Khadija Amin, Opposition Senator, member of the committee.
And I'm Paul Richards, the chairman for this committee. I'd like to invite the members of the two groups. Okay. Members of both ministries who are represented here today to please introduce themselves, starting with the officials, from the Ministry of Health.
Morning, Chairman and members. Dr. Roshan Parasram, Chief Medical Officer.
Good morning to the committee. Yvonne Lewis, Director, Health Education Division, Ministry of Health.
Morning. Dr. Rohit Doon, Advisor, Public Health, Ministry of Health.
Good morning, Chairman and committee members. Renee Franklin, Technical Director, Project Implementation Unit, Health Sector Support Program, Ministry of Health.
And we'd just like to note that the PS, Ministry of Health, is unable to be with us today. Is that so? Thank you. All right. Could we have members, officials of the Ministry of Education to please introduce themselves, starting with the Acting Permanent Secretary?
Thank you, Chairman, and good day to members of the Joint Select Committee. My name is Leno Batiste Simmons, Permanent Secretary in the Ministry of Education.
Good morning, everyone. My name is John Rupchan, and I'm the Acting Chief Education Officer, Ministry of Education.
Good morning, everyone. My name is Professor Dennis Conrad, and Manager of Student Support Services Division. Again, good morning, everyone. My name is Dennis Conrad. I'm Professor Dennis Conrad, Manager, Student Support Services Division.
Good morning, all. I am Stacey Barron, the Chief Executive Officer of the National Schools Dietary Services Limited. Yes.
Good morning to the Chairman and the committee. My name is Vanessa Martina. I am Program Manager, Nutrition Services of the National Schools Dietary Services Limited.
Good morning, all. My name is John Thatcher. I'm Curriculum Coordinator, Acting Physical Education, Curriculum Planning and Development Division, Ministry of Education.
Good morning, all. Teresa Nelbert Skinner, Curriculum Coordinator, Social Sciences.
Good morning, all. Simone Haynes Noel, School Supervisor 3.
Good morning to the committee. I am Marla Morton-Gittins, Acting Director of the Curriculum Planning and Development Division of the Ministry of Education.
Good morning, everyone. I am Leticia Rodriguez-Cupid, Coordinator, Special Education Unit, Student Support Services.
Good morning, Chairman and members. I'm Irma Bailey-Reyes, Behavioral Specialist, Student Support Services Division.
Everyone's introduced themselves? Thank you for that. Just to remind you, feel free to pull the microphone closer so we can hear you. All right? Let me just outline the objectives. We have three objectives of the inquiry. One, to examine the trends in obesity and associated illnesses among the student-child population in Trinidad and Tobago. Two, to assess the services and facilities available to counteract and/or alleviate childhood obesity. And three, to examine the effectiveness of the school nutrition program in the reduction of childhood obesity in Trinidad and Tobago. At this point, I'd like to remind members or our guests represented here today, officials, to direct their questions and concerns through me, the chair. We'll also remind members and officials to kindly activate your microphones when you are ready to contribute and acknowledged by the chair, and to turn it off when you've concluded your contribution. And of course, we will continue with that. Let me just start by saying that we are well all aware of the most important aspect of life in any jurisdiction. Certainly, I can speak for Trinidad and Tobago, and that's human capital, which is the people of our country. It's the most important asset we have. And out of that cohort of persons in any jurisdiction, to me, the most important in terms of where we need to focus is our children, the younger population. And just to give a bit of a background, worldwide, the adoption of industrialized Western society lifestyles is now being associated directly with increasing obesity. The shift toward what has been described as a westernized dietary pattern and lifestyle habits has brought about a new nutritional scenario in many developing countries. These countries are now faced with the twin problem of either malnutrition, undernutrition among some segments of the society, and problems of obesity and associated disorders in groups. The burden of chronic non-communicable diseases, or NCDs, cardiovascular disease, type 2 diabetes, cancer, respiratory diseases is increasing in developed and developing countries globally. In 2005, these diseases accounted for 60% of all deaths. And 80% of these deaths occurred in low and middle income countries. Data from 2004 showed in Trinidad and Tobago, 74% of all deaths among men can be attributable to NCCDs. Among women, the estimate is even higher, 81.7%. Non-communicable chronic diseases are characterized by the relatively long natural history. At the individual level, most of the disease progress start at very young ages and, of course, progresses through one's life course, which means that the alarming rates of obesity, and we quote some data later on in our discussion, hopefully, to show that we in Trinidad and Tobago are leading in statistics regarding 15 to 13-year-olds in overweight, a category called titled as overweight, and also obesity. We're leading Guyana, Barbados, and Jamaica in these categories. And it is not something that we need to be proud of, because it is affecting the lives and the health and the well-being of children. And it is developing lifestyle habits and nutrition habits that children are taking into adolescent, early adulthood, and the rest of their lives. I know, and I don't have the exact statistic, and I'm sure the CMO can give me the exact statistic that the Minister of Health is on record, and the past Ministers of Health, as saying that more than 55% of the Health Ministry's budgetary subvention goes toward interventions for non-communicable diseases driven by lifestyle patterns. And that needs to be addressed, because we can save so much money and redirect it and have better wellness in the country if we are more preventative in our approaches to these issues, particularly where it relates to our children. So let me open the discussion with you good people. Thank you once again for joining us, with brief comments from both heads of delegations. We'll start with the Ministry of Health.
Morning again.
Morning.
I take this opportunity to recognize the importance of our children's health and to reaffirm the commitment of the Ministry of Health in creating an environment to develop and implement strategies in dealing with the prevention, treatment, and care of childhood obesity. Towards this end, the Ministry of Health has adopted the whole of government and whole of society approach as the main strategy for reducing the growing burden of NCDs and its determinants. Being cognizant of the fact that the control of factors which facilitated and continue to facilitate the development of NCDs and the epidemics are both within and external to the health sector. To complement these interventions aimed at promoting healthy eating and the creation of healthy food environments in schools, The ministry has developed an NCD strategic plan that includes an initiative to support the schools and communities. At its core, this plan requires children and their families to engage in regular physical activity and active living with the goal of reducing the prevalence of childhood obesity in the short and medium term. It must be noted at a previous Joint Select Committee held on December 14, 2016, which recommended 1, the ban on sugar-sweetened beverages and unhealthy snacks at schools, and 2, the development of programs to educate parents on the promotion of a healthy lifestyle. To this end, the Ministry of Health is proud of the fact that in September of 2017, we fully implemented the ban on SSBs in school, and we are 90% complete with regards to the unhealthy snacks, looking to implement in September of 2019. With regards to development of programs to educate parents, that occurred and started in the first quarter of 2017 and continues. It is envisaged that today's proceedings will be insightful toward promoting greater synergies with the Ministry of Education and other stakeholders, both in the public and the private sector, including the NGOs and civil society, towards the improvement of children's health. Thank you.
Thank you, Dr. Parson. Can we have the opening statements from the Acting Permanent Secretary, Ministry of Education, please?
Thank you, Mr. Chair. In keeping with the strategic goal of providing quality education, the Ministry of Education is committed to the promotion of health and wellness for all learners. In addressing the issue of obesity and healthy lifestyle, the approach of the ministry is both holistic and collaborative. The holistic approach incorporates the work of the divisions of Curriculum Planning and Development, the Student Support Services, and the National Schools Dietary Services Limited. Through our curriculum planning and development, we design, develop, implement, monitor, and evaluate the national curriculum in subject areas such as physical education, health and family life education, science, and food, nutrition, and health. Through our Student Support Services Division, we seek to promote healthy lifestyle and support students in making informed choices for personal safety and well-being, regardless of their personal challenges. At the National Schools Dietary Services Limited, we are responsible for the management of the school nutrition program in Trinidad. This program provides safe and nutritious breakfast and lunch meals to approximately 30% of our school population. As we treat with matters regarding life choices and healthy lifestyles in schools, the Ministry of Education works collaboratively with several stakeholders, including the Ministry of Health, through their Health Education Division. It is important to note that the overall aim of all initiatives of the Ministry of Education is to help learners move beyond mere knowledge acquisition to lasting behavioral lifestyle changes that will result in healthy and happy living. With those few words, Chairman, I will stop to allow your committee to take lead on the discussion. My team and I will be happy.
Thank you so much to both of you. We appreciate you being here again. There had been 2 surveys commissioned by the Ministry of Health, and commendations in that. The Global School Health Survey, GSHS, in 2017, and the evaluation of school food options and surveys of body mass index, BMI. And despite our best efforts, and I say our as a country, and the really clearly articulated vision for the Ministries of Health and Education in trying to deal with this burgeoning problem of childhood obesity among young people, the data from the GSHS survey in Trinidad and Tobago over the past 5 years indicates that nationally, the level of overweight and obesity in adolescents 13 to 15 was 51.1%, which represented a 13% increase in overweight/obesity among this population over the 5-year period 2011 to 2017. The level of obesity increased from 5.7%, or increased by 5.7% from 11.9% in 2011 to 17.6% in 2017. And the level of overweight increased by 7.3% from 26.2% in 2011 to 33.5% in 2017. And I know there are many components that go into a child's nutrition. It's not only what the child eats at school, the home is a very important part of it, the home circle, and the community and the playgrounds and the interactions in social circles. But with that said, let me ask Dr. Parasram, what do you think are the main contributing factors, despite the efforts of the ministry in the last 7 or so years, that is driving these alarming statistics in overweight and obesity levels?
Basically, I mean, and not only in Trinidad, worldwide there has been an increase as well. I think the two main factors are decrease in physical activity, one, and increase in consumption of unhealthy foods. So those, bearing in mind, they have been the targets of the Ministry of Health in most of the programs. So we're trying to do one, get physical activity up and decrease the consumption of unhealthy foods and drinks. And that's our two main activities. So I think those two factors have led over the previous 7 years or even a little bit longer than that to increasing rates as the two main overarching factors.
Mrs. Lenore Batiste-Simmons, from your perspective.
Again, I would like to endorse Dr. Parasram, what he has said in terms of physical education and in terms of the fact that a lot of our parents probably are not at home. Our students are left to probably fend for themselves in terms of meals in the afternoon. At school, again, we are noting that students are not playing as much.
What does that mean?
Playing in terms of, I mean, at school, when I went to school, there were times when you were allowed to play. For example, during the break times, it was a time for play.
Why I ask you play? Because my nephew plays on his video game. So you need to classify play.
Let me,
right?
okay.
You mean physical play. All right.
Sorry, and apologies. Physical play, as opposed to playing on a PlayStation. Again, probably there's a gap sometimes. When I say play, I would not. Yes.
Anyway, we don't specify.
Yes, yeah, I must specify clear. Physical play, as opposed to you find most of our children, again, as you said, they're playing with handheld devices, as opposed to going out and playing on a field that allows for mobility. So I think from my perspective, but again, I can ask Professor Dennis Conrad to elaborate further in terms of what they have seen in the school environment.
Certainly.
Okay, thank you.
Could you pull the microphone closer, please?
Okay, certainly. I would endorse the need. We have limited classroom space also. The typical classroom is going to be smaller than I've expected. And we have, our students are also, with a lot of other stresses that they're experiencing that may not, because of the focus of academic achievement, we have many of our students who are trapped to the desk, trapped to the chair. And as such, being able to have in activities that bring out their best, burn up that energy, get them to engage with others, these are all elements of physical activity that would enhance their well-being. So for me, it would be an endorsement of the role of physical activity.
Thank you. I'm a little bit confused. I'm kind of switching the questions around now because, Professor, you're indicating that the classrooms are small. But for me to play moral and hopscotch and pitch, I don't do that in a classroom. I need to do that outside, and therefore the space of the classroom doesn't really come into question here. It's really the availability of the space outside and whether the children are being given the time, or are they being told, we don't want you sweaty and we don't want you smelling, so therefore we are going to cut off this time for you to be able to concentrate on your work and to be, at ease. But before you say that, I just want to come back to the opening statement of Dr. Parasram and of course of Deputy PS. And I'm wondering, is there, because you both have policies, but you're hoping, I'm asking here, do you have a relationship with each other where you'll actually meet and discuss the way forward? Because, and how often do you meet? Because, the government schools have not really been the ones who have been able to implement the policies that are put forward by the Ministry of Health in terms of reducing the sugary content being sold. as opposed to the non-national schools that are actually implementing it. So what sort of relationship do you have with each other in terms of going forward to address this situation here?
We just asked Ms. Lewis of the Health Ed Division to speak to that question.
Thank you very much, Dr. Parasram. With respect to the relationship between the Ministry of Health and Ministry of Education on issues related to childhood obesity, we have formalized and improved that relationship over the last 3 or 4 years. We meet with the Chief Education Officer every 3 months, and we meet around the issues relating to childhood obesity and actions to prevent that. Particularly, we're looking at what we call the Healthy Schools Initiative, which looks at creating supportive environments in schools for children to adopt and maintain a healthy lifestyle in relation to nutrition. We're also looking at in relation to physical activity, and also the supportive environment with respect to the curriculum. We have also added to the NCD Oversight Committee that looks at the implementation of the National Strategic Plan for Preventing and Controlling NCDs in Trinidad and Tobago, a component of which addresses childhood obesity. We have a formal member of the Ministry of Education on that committee.
Ms.
And
Lewis,
that committee,
you
yes.
indicated that you all meet every 3 months. When was the last time you met?
We met in December. So we would have met in December because we have a series of actions that we've jointly undertaken. In December, we met to share the report on the assessment of physical activity in schools. That activity was implemented as part of the NCD plan and the health sector support program. And there was a consultant that was hired to do an assessment of physical activity, and that was done with the support of the Ministry of Education. That report was prepared, and currently the Ministry of Education, they are preparing their proposal on how we go forward with the recommendations.
Thank you, Mr. Chair. My concern, let me first congratulate the Ministry of Health on its initiatives with respect to this. When I read your report, I thought we were certainly on the right track. What I'm concerned about is implementation of the various initiatives. And in this regard, I would like to hear from the Ministry of Education in particular, because what we found when we did an earlier study, an earlier review on another subject matter, was that even at the Ministry of Education level, you had a lot of plans, but filtering it down to the schools was where we fell short. So how do we ensure that all of these plans and initiatives are actually filtered down to the benefit of the children in the schools?
If I may, through the chair, member, the school curriculum is designed to address all the needs of the child. And that's the intention of the document and the implementation process. As indicated by our colleagues from the Ministry of Health, we work collaboratively. Certainly, there are some aspects of health education that we do not have the technical expertise in the Ministry of Education, and therefore that reinforces the need for us to have that close collaboration so that whatever we are doing is synchronized. That being said, the curriculum that we implement in school is a policy document, and the areas of health and family life education, physical education, food and nutrition, and even the sciences, our intention is to reach the student population through curriculum implementation. Yes?
Yes, go ahead, Member West.
I appreciate that at this level, there seems to be adequate communication and planning. What we learned on the last occasion was that implementation through the schools was done via the school supervisors and down to the principals of the schools. But when we spoke to the head of the PTA, National PTA, it was evident that that filtering down did not occur. So how do we ensure that things are actually filtered down and implemented? That's my concern.
Okay, I apologize for
What is the
misreading your
feedback
question.
mechanism?
Sorry. Yes. What I'm saying, though, is that the implementation of curricula and the sensitization of stakeholders are really what we try to get through as a Ministry of Education. While implementation of the curricula would be the responsibility of the teachers and the supervisors, curriculum officers, more particularly, the sensitization and awareness by getting through to PTAs and things like that, that is really optional on the part of the PTA. When I say optional, the parents normally that you want to see are the ones who wouldn't attend PTA meetings, yeah? And therefore, what we do, we have tried by putting up posters, advertisements of what our initiatives are, albeit that some of the data collection reveals to us that the awareness through posters and whatnot has not been working as we hoped. But clearly, awareness for parents and students in terms of sending out circulars and things like that, that has been a little more successful.
Can I ask a question? You say you've used the poster mechanism for trying to, in your attempt to disseminate information. Have you heard of a little thing called social media?
Yes, Chair.
Has that been employed?
Yeah, I can't say that we have taken that totally on board, but it is being considered.
The cohort that you're trying to reach in terms of children, and certainly their parents, if they are toddlers and 8, 9-year-olds, is going to be social media and web-based platforms. So if you're not targeting that and you're putting up posters like 15, 20 years ago, maybe that's the start of your problem. Yeah, let me just go to member, Jenny Smith.
Yes, and I want to follow up with that question. I want to stay there and ask, what are the mechanisms that the ministry is using to determine the success and feasibility of the program?
Of which program, if I may, member?
The same program.
The same program, yeah. Okay, well, in terms of the ministry and our initiatives that we have put forward, it has been rolled out, as I say, through the curriculum, one, and our collaboration with Ministry of Health. And our collaboration with Ministry of Health, permission and approvals have been granted for officers from the Ministry of Health to access schools and access children so that they can effect the aims and objectives or the initiatives, as I say, of the program.
Thank you. Member Hussein, you had a follow-up question.
Yeah, I was coming back to the utilizing the social media. I mean, instead of putting forward a documentation that you will read, which most persons really don't look at, you could probably put an animated form of exercise or way of communicating with each other so that, it's more impactful. And therefore, at that rate, you could probably hope to penetrate the homes with more success. And of course, you could have some sort of survey where parents can actually respond to you that they like it or it has improved or things like this, because you must have a monitoring and evaluating system to be able to determine how successful your program is. But I just want to come back to something that Acting PS had indicated, and you said regarding the supply of meals, you said that that you ensure that 30% of the school's population is in fact provided with meals. How much does 30% represent?
Ms. Barron, can you respond?
Good morning again. The 30% that we provide equates to 136,000 meals per day. So what we provide now is 80,956 lunches and 55,114 breakfast meals.
Thank you, Member Amin.
Thank you, Mr. Chairman. I'm listening to the suggestions in terms of the initiatives you have engaged so far, and I appreciate the suggestion for the use of social media. But I am a mother as well, and I think there are schools that tell parents do not send sugary drinks. They do not sell those drinks in their cafeteria. Even in preschools, children must bring a fruit in their lunch kit, whether they like fruits or not. and it is a part of their rules. Has any of your initiatives been in that direction in terms of making rules? We have state-run early childhood care centers, preschools. We have the infants departments so that these children can be trained, their taste in snacks can be trained from a young age. Have you taken any initiatives in that direction?
Yes, Member, through the Chair. To respond to that, the sugary beverages policy has been implemented. We have collected some data in terms of the impact so far, but what we have collected so far is incomplete. As I'm saying, it's preliminary, but I can give you some information here that we have so far collected data on 480 schools, comprising 374 primary and 106 secondary schools. We target, the responses came from about 162,137 students so far. And what we realize is that the awareness of the program has been met by over 97% of the respondents, you know, but again, if we go back to posters, there was a low visibility of posters, just about 20%, and unauthorized.
Just about how much percent?
About 20%.
20% visibility of posters?
Posters altogether.
And where were the posters located?
Well, the posters concern, it would be in the schools area for people who would be coming to collect their children and so forth at school and to drop them off. But the average of about 20% covers different types of posters. Posters that talks about sugar-sweetened beverages, reduced sugar posters, as well as no sugar added posters, different posters that we have put out there. But the essence of this is that even as you talk, Chair, about social media, you will recognize that the awareness is over 97%, as I quoted. And that may be as a result of the younger folks and the children themselves through social media would have been making themselves available to those kind of messages. But significant in all of this is that unauthorized vendors at schools, outside the school, is down to 5%. Yeah, and we feel that there is some level of success as we go along with this initiative.
I want to know what you measure your success by. Is it awareness, or is it compliance, or is it change of behavior? Because you alluded to the fact that you had an increase of 7.3%. So what do you measure success by at this point in time?
If I may, we are at the point of just introducing this initiative, and therefore the impact or that level of success we're looking for, it is to be done over a period. What we are looking at right now is just the awareness. How effective are we at getting the message out there? And that is what we can measure as a Ministry of Education. In terms of the other technical things that we will need to, our collaboration with Ministry of Health, we will be able to spin that off as we move on in time.
Could you please briefly outline to me the short, which would be the awareness, the medium, and your long-term targets for what's going on with respect to obesity?
If I may, Chair.
Absolutely.
With regards to the sugar-sweetened beverage, we looked at compliance. It was a policy directive that all public sector schools, by September of 2017, no longer sell SSBs in their schools. So that was the policy directive. We looked at compliance thereafter, looking at all the schools to make sure they comply with the policy. And our figures have been for 2017, and it was in our report that we submitted to the Joint Select. 2017 soft drinks for primary schools, 97.6%, secondary schools, 100%. 2017 primary schools for juice drinks, 80%, and 66% for secondary schools. Sports and energy drinks, 2017, 96% for both secondary and primary. Flavored waters, 91% for primary, 98% for secondary. And with regards to 2018, I think we did a little bit better. 99% for soft drinks for primary, 97% for secondary schools, 84% and 70% respectively, primary and secondary for juice drinks. Sports and energy drinks went up a little bit, 99% primary, 94% is secondary, and flavored waters, 94% and 83% secondary. And that is an ongoing process of monitoring and evaluation that will continue to ensure that they don't sell, but I mean, that takes care of the bit. In school, sometimes it doesn't capture, as Member Amin would have indicated, that some parents will still send sugar-sweetened beverages in their lunch kits. That is something that we have to look at in terms of compliance. How do we, in terms of policy, direct that? And of course, what happens outside of school is another target that we hope to get to.
Just before I go to Member West and Member Amin in that order, and Member Ford, has there been any attempt by the Ministry of Health to dovetail the the parents bringing their children in for obesity-related issues, diabetes, etc., and doing some sort of study, whether it be short-term and or longitudinal, to find out if the awareness and education program is having the desired effect, and also where the children or the parents may be actually acquiring the sweetened juices and their eating or nutritional habits.
It is the only way we can do a study of that nature, because it started in September 2017, is that we have to do a prospective study. So the prospective study will be done in the coming years, but with that start point, we have to see as we go forward. And it would be a good target to look at the cases of NCDs. Once we establish our registry, we can have a registry of all the cases of NCDs and then link them back to the consumption patterns. But that will have to be done prospectively over a number of years.
Before, and then Member West.
I want to sort of slightly concentrate on the physical activity that you all spoke about. All right, we are talking about children basically between the ages of 13 to 15. That's the discussion, or we thought we dealing generally with children, right, primary and secondary. All right, we know from early childhood, we know from primary schools, activity is very heavy with regards to children running around the school, doing various things. But then when we go into the secondary school system, there seems to be it to be more sort of structured in that we go to physical activity and you have generalized classes along those lines. Now, in terms of the curriculum, are all secondary schools tabled with regards to have physical activity throughout our educational system?
Yes, we have Vice Chair, and I would ask Ms. Morton-Gittins, the Director of Curriculum, to respond.
Okay.
Yes, Sue. With regard to physical education, physical education is among the core curricula at the lower secondary level. So it's on the timetable for all of our schools. And with regard to physical education, it is recommended that per week that there are 3 periods of Phys Ed per week across schools at the lower secondary.
And that takes place?
Physical education, yes. I will also ask the contribution of our Phys Ed Coordinator with the permission of the Chair.
Yes, but Member Ford is asking, it being in the curriculum is one thing. I used to duck Phys Ed all the time. So that doesn't guarantee that students are actually engaging in the Phys Ed. You know, I would go and play my basketball, but not in the school. And there must be some mechanism to, like math, like chemistry, like physics, to be able to determine if students are actually engaging and at what level they're engaging. So I think that's the members' direct question.
In terms of it being compulsory, participation of the students on, you said 3 days a week? 3 periods for the week. All right, yes. So again, you said you were going to refer to the physical education coordinator. So I'm interested, the coordinator. So I'm interested in knowing exactly, you know, what takes place, and then I'm going to reference with regards to the manual you provided in terms of short staffing and so on. Go ahead.
Good morning again. Thank you, Mr. Chairman. Physical education is core to the curriculum at the lower secondary level. That is to say, forms 1 to 3. So it's core. It's mandatory. That's our policy. It is in our policy document. The question I believe that you are asking is whether or not implementation is taking place.
Definitely.
What systems do we have in place to ensure that? 1, we have a school-based management system, and we have a district based management system. So we have something you call a DLT, district leadership teams, which are headed by school supervisors, and also it is an interdisciplinary team, curriculum coordinators, and people from SSSD. They have a responsibility to ensure that in the district, implementation is taking place. At the school level, we have the principals, and I believe it was 10 years ago, we introduced officially heads of departments, and they also have a responsibility in terms of instructional leadership at schools, including supervision of the implementation of the curriculum by teachers. They are allotted time in most schools to have departmental meetings. They're expected to review plans of work for physical education. They are also expected to do clinical supervision.
That's policy.
Right.
The member is asking about monitoring and documentation of participation.
The actual physical activity that would take place at these particular, you said 3 periods per week? Right. And okay, let me reference it to the document you have here. According to Appendix 8, right, it is said that you all have a short staff of coaches.
Agreed.
Right, agreed. So I am saying, during these 3 periods, what transpires?
Okay, member, Mr. Chairman, let me first indicate that we have basically 4 programs we should have 4 programs, physical education programs at schools. The first one is called the basic program. The basic program is the core program where teachers are employed to teach that program. It's timetabled. Then we have the intramural program. You will know it as the inter-house, inter-school, inter-class programs. They are competition-based programs, and they occur within the walls of the school. The third program is the inter-school program. Coaches are employed for the inter-school program. Physical education teachers are employed, and they have to teach the basic or instructional program for which 3 periods are provided, but they teach both theory and practical.
Can I interrupt you? It's commendable that you're extremely well versed on the ministry's policy. That's clear. Okay. You come prepared. But what the member is asking is what actually happens in those 3 periods. And my additional question is, how is it documented? Like you have a math test, we know a student participates in the curriculum, the exposure to the information. It is assessed in a test, it is documented at the end of the term, so we know student participation in class is X, student score is X. We need to do X work so that the physical education part of the curriculum is as measurable as any other part of the curriculum. That is what the member is asking.
And if I may add to that, Mr. Chairman, right, we can be very specific. The chairman and myself attended the same college, Hillview College. And back then, when we had P period, we would go out in the honeymoon savannah. We will have the particular coach there, and we will have different activities: cricket, football, rugby, basketball, volleyball, as the case may be. And from there, different individuals will be identified for futuristic prospect in being able to say, you can be an athlete to represent the school, as the case may be. So we would start off jogging, we would start off stretching. Are those things taking place presently, 2019, in schools?
Mr. Chairman, we have teachers, and they are expected to deliver the practical. Yes.
Sir, one second. I'm sorry to interrupt you. The member is asking not what is supposed to happen. He's asking if
those things happen.
Yes, the teachers
jogging and running and playing football and in a structured way to a point, and then after that, we know, look, you can represent the school later. Go to the running coach. We suggest to parents that, listen, this child should pick up running. This child should pick up something along those lines.
If I may, Chair.
Absolutely.
I think what my colleague is alluding to is that we have the structures in place. The degree to which we have it actually taking place is contingent on what happens at these specific schools. Yeah.
And how do you monitor what's happening at the specific schools?
Yes, so we continue to monitor what is taking place in school, but I just want to slip in one thing here. The nature of physical education today in school is different somewhat to what physical education was defined at in your day in school, if I may. You see, what is happening now, in days of old, physical education was not an assessed program, right? Physical education, you had a PE teacher there and you just go out and do PE. And PE, back in those days, was seen as just playing, running on the field.
Actually, you referenced back in my day. And
in our day.
Back in our day. And I will tell you, I will have to counter that because just as I was given a grade in math and English and physics and chemistry, I was given a participation grade in my physical activity. So it was assessed back in my day.
No, but then added to that, Mr. Chairman, we now have physical education at CSEC level, at CXC level, and as the case may be. So therefore, now it should be even more, emphasis should be more placed on it now than even back then in our days, as the case may be. And you see why I'm able to say that is because the most you hear from most schools is a sports day. Right? As the MP for my constituency, I'm invited to a sports day. I'm very active. You don't see children running around in the schoolyard. There's no sort of physical activity with regards to primary schools, with regards to secondary schools taking place. There's an annual sports day, and that's about it. So again, I don't know if you
and let me ask you
say something.
Let me ask you, I know what the policy is. You've been very good at identifying the policy and what is supposed to happen. From your vast experience, do you get a sense that equal or enough emphasis is placed on ensuring that this physical activity component is as important as we feel it should be in terms of actual practical application from primary and to secondary school? Because if it doesn't start in primary school, you don't develop the habit and the love for physical activity.
Yes, Chair. If I may, the fact that physical education and sport has now become compulsory on our curriculum is a signal of the importance that we place on physical activity. We are severely challenged in dealing with a population where the technology has isolated children from interacting with their peers, even sitting in the same space, and they're on their phones or whatever they're on, and they are not communicating physically. That has sort of encroached on the time that students would have otherwise been spending out on the playfield doing something physical. But to say as a Ministry of Education, the fact that we have put it as a compulsory program on our curriculum, it means that we are there now to make sure that this happens. How? We have a formalized curriculum. We have it being taught. Yes, the issue of staffing has been a challenge, and we have put out policies on employing and bringing back coaches from outside of the school to help us along those lines. But really and truly, it is not fair to say it's only sports day we have, because we have inter-school programs. We have recently started also with the establishment and re-establishment of a series of SNSOs, schools, national sporting organizations. And we have revived them. The Physical Education and Sport Unit of the Ministry of Education has been mandated to revive all those who are sleeping. That has happened because over the last few years, the Curriculum Planning and Development Division was severely understaffed in the area of physical education. And we have since, over the last 3 or 4 years, we have been beefed up to now have 12 officers serving in the Curriculum Planning and Development Division. And we are working feverishly to ensure that physical education and sport incorporating all sporting activities in school are structured and well engaged.
Just an additional question before I go to Member West. With reference to the equipment that is also needed to augment the physical education programs in the school, can you give us a sense of the status of how schools are evaluated by the ministry to ensure that they are furnished with the necessary equipment and auxiliary stuff needed, and how are requests from principals dealt with?
Yes, Chair. Schools upon establishment, schools would be outfitted with the physical establishment and facilities. a request will come to the curriculum planning and development when a school is being established to make our recommendation of what are the kind of equipment that they should be outfitted with regard to physical education. These things are determined by the number of classes, the number of students at the school, and so forth. And therefore, we make that recommendation that is passed on to I think, planning.
It is passed through to our Educational Facilities Planning and Procurement Division. It is what is also incorporated into what we refer to as our Architects and Users Brief that determines how we would, our schools are going to be designed and so on. So all of those things are taken into consideration when we're doing it. But before we move ahead, there's a program that has been initiated along with Ministry of Health that my colleague would like to speak to.
Yes, Chairman, before, I just want to complete the issue of equipment. And you spoke about equipment in terms of the facilities, but in terms of rackets, balls, things for them to actually use in the day-to-day play. Sometimes it takes very long when they send the requisition to get those things in the school, and they have broken rackets, deflated balls for a long time. Some schools.
Also, I'm listening to you speak, and you speak about the school, but if you're looking at the family, I would look at continuity. So from when you leave school, there's continuity, and the savannas can be one of the ways that you can have the families incorporated. Have you looked at the Ministry of Local Rural Development and Local Government in terms of having the savannas that are close by upgraded, maintained, equipment put in so that there is some sort of continuity from school into the home environment?
If I may, Chair, the Ministry of Health, as you may have known previously, we entered into IADB loan in 2016 that actually has components dedicated to the procurement of physical equipment, education equipment for schools. It's quite a large component, so I'll ask Dr. Doon to speak about how the assessment that was done. So we did a rapid assessment of all schools that were earmarked in terms of the space, the capacity, and we tiered the procurement based on the size of space available. So Dr. Doon could begin the conversation, and then Ms. Franklin can continue and tell you where we are at in terms of procurement of the equipment to be placed in the school.
Thank you.
Yes, morning again. The Ministry of Health, in conjunction with the Ministry of Education, because we are very, very close partners, we realize we can't do this thing together, each working in silos. And so we engaged a consultant, and the consultant conducted a survey of physical activity capacity. Capacity being people, the teaching side of physical education, and the equipment side which you mentioned. So so both components were examined and found to be required. What we decided was that from the study results that there was going to be need for a whole suite of actions. The ministry, as with the Ministry of Education, created this equipment list that you spoke about. So that is only for primary schools. We're going to be moving into the secondary arena as soon as we tidy up this part of the program. That list is complete, and the tender documents are also complete, so shortly it should be going out for public tender to acquire the equipment. Again, I emphasize we're working with the Ministry of Education on this aspect. The other issue is the insufficiency of physical education teachers in the whole educational environment. And again, through our health sector support loan, the Chief Education Officer and our team, they have been having serious discussions so that they are the position where they're going to make a proposal to the Ministry of Health to increase capacity in physical education so we could fund this, so we could build both components at a time and have a robust physical activity program throughout the educational environment.
I want to shift a bit. In your submission, you had stated here an establishment of staff for your Nutrition and Metabolism Division. And I want to ask you, what is the ministry's time frame for the commencement of the recruitment process for the 4 nutritionists, dietitians, and 8 food demonstrators? And I'm asking you this because when we have obesity and we have a child who is obese and you have a parent and we give them rules to follow, they go into a stage of confusion. They don't know what they can eat. They don't know what they can prepare. They don't know in what quantity. We will tell them don't eat sugar, so they feel they can't eat anything at all. Yeah. So that's why I'm asking you the question specifically for the nutritionists, the dietitians. Can you give us an answer on that?
Yeah, so the chief nutritionist post was recently filled not more than, I would say, 6 months ago at the Ministry of Health. And since she has been in office, she has already sent in a plan through my office to the Permanent Secretary asking for the full establishment or part thereof to be filled. It has been recommended from my office and sent to the PS. The process has already been initiated. These are public sector posts. So they are established posts. They have to go to the Public Service Commission. So we have already initiated the process through Public Service Commission to ask for the positions to be filled. That is the public service side of it. That is a bit outside of our hands because when we initiate that discussion, the public service then takes over in terms of the recruitment part of it. So I can't give you an exact time frame as to when that section of it will be completed. But having said that, there are 32 RHA dietitians, which are outside of this structure, which function. RHA are contractual positions, and they sort of fill the gap from the regional health authority side. So this is a somewhat old establishment at the Ministry of Health, and what we are seeking to do to some extent is divulge some of the clinical services delivery to the RHAs, which is one of the main reasons the RHAs were set up in the beginning, and retain the policy function in this division at the ministry.
So one last question.
Yeah.
You know, I remember we talk about in our days and nowadays and things like that.
Right.
So I remember in my day, when I would see those brown uniform people from RHAs visiting houses, homes, right? So is it part of your program to target homes and have these persons, as you said, 32 of them,
the brown
visit, like, because sometimes you have to go to the people's home and help them out.
Well,
Do you have that as part of your plan?
I think you'll be happy to know the people in Brown are still there. They are DHVs, District Health Visitors, and part of their core responsibility is really not to be based at the health center alone, but to be responsible for the community as it serves, because NCD care doesn't occur at the health center. It starts at the home and starts at the community. That's where prevention begins. So the DHVs are part and they lead the health center trust, together with the nutritionists.
Well, I would like some kind of emphasis to be played on visibility.
Okay, maybe we could change the color of their uniform.
The color is good. No, the color is good, but somehow maybe we don't see them, you know, as we used to see them long ago in the community.
You know, I want to add another component to our conversation. Excuse me, this morning, and I'm glad Member Jennings took us back to the nutrition aspect of it, because in doing research for this interaction, looking at best practice around the world, there's a quad that works in terms of 4 main components: education and awareness, health services and interventions, education system, and also the issue of exercise. Let me just ground my next question, which may be considered quite controversial. So I know we have to be careful in how we tackle it, with another bit of statistic from the Global School Health Survey, GSHS, where there was a comparison by country in terms of data. And the 4 countries, or the 3 other countries compared to Trinidad and Tobago, or in the document it actually says Trinidad, I don't know if Tobago was included, were Jamaica, Barbados, and Guyana. And they were considered comparative countries in terms of socioeconomic and demographics. And the 2 categories were overweight 13 to 15 and obese 13 to 15. And we have a wonderful statistics that puts Trinidad Tobago ahead in all categories, where overweight 13 to 15, Trinidad, I'm presuming Tobago is involved in that, included in that, because I would hate to think we left out Tobago. Yeah. 33.3%. Barbados, second, 31.9%. Jamaica, third at 25.6%. And Guyana, fourth with 15.3%. In terms of obesity, 13 to 15, Trinidad Tobago leading 17.4%, Barbados 14.2%, Jamaica third 10.1%, and Guyana 4.1%. And something occurred to me because my brain likes to make intangible associations and connections, that it may be posited that the countries with the higher GDPs and are able to import more are leading. Is that a wrong posit?
If I may
Incorrect?
just, if you look at the data in the table, you will note as well that the data for Barbados was 2011 and the data for Guyana was 2010.
Mm-hmm.
So it is quite old data. So
yeah.
I think comparatively we could look to Jamaica in terms of having a more realistic figure compared to us.
Mm-hmm. But we're still ahead.
But we're still ahead.
And it leads the question about, we spoke a lot about the school nutrition program, but a large part of it also is what children and families consume at home and outside of the school context, and the availability of healthy alternatives and the availability of cheaper, poor nutrition, high sugar alternatives at retailers. And I'm not going to demonize the private sector here, but it is a consideration and a conversation we must have, because I know in developed countries there has been a strong lobby by parent groups and teachers groups to deal with the supersized syndrome and the over-sugared saturation syndrome, because you could exercise all you want. If you're consuming 700, 1,200 calories in sugar juices, which are cheaper, and placed in retail outlets where you are exiting and you can grab, it is going to be part of the component. So the question to the Ministry of Health first, and then the Ministry of Education, is what are we doing to combat this? And I don't even want to start with the fast food outlets and the fried foods, you know. And let me add another component to this. And what is your collaboration with the Ministry of Agriculture / Food Production in healthier local alternatives, which can help reduce our food import bill also?
I'll start it and then Ms. Lewis will take over. With regards to what we are doing, we're looking into the sugar tax. When you focus on the disparity and saying the cost of eating unhealthy foods is actually less than eating healthy foods, and more convenient. What we have noted in other territories, including the UK, is that they have imposed a sugar tax. So, for instance, it will become more expensive to consume a sugar-sweetened drink than a natural drink.
And could you just explain for the purposes of our viewers and listeners, what is the sugar tax mechanism? So the perceived or proposed sugar tax mechanism? Right.
It's basically based on the amount of sugar it's proportional. So it's proportional to the amount of sugar in a beverage, added sugar. So for instance, a soft drink will have a certain percentage of added sugar, so the tax will be greater if you have a higher proportion of added sugar, and your tax will be less in the opposite direction.
So it's going to cost more?
So yes, it will cost more. The more added sugar you have in a beverage, the higher the cost. So it will actually be inversely proportional to it. The other initiative we have...
What's the time frame on that proposed sugar tax, which I'm sure you'll get a lot of pushback for, unfortunately?
It is something it is a very difficult... we are working the actual figures to see what it will look like in Trinidad in this model. So we have looked at the UK model in terms of the taxation schemes. We are looking at what level we could actually introduce it at. But having said that, the implementation will be difficult because we have manufacturers in Trinidad and Tobago. So we have to do a lot of stakeholder analysis and consultation prior to going forward. And of course, it will have to go to Cabinet for consideration.
Chair, thank you. Going back to the physical education aspect of this, two things. One, my recollection is that you indicated that the compulsory physical education program ran up to Form 3. What concerns me is that seems to coincide with the start of the biggest group of obesity and overweight children, because we're talking about children 13 to 15. So we're saying to them that you only need to get into the physical education program until you get to Form 3, and then the obesity problem really skyrockets. if we are talking about creating lifestyle changes, should we not be discouraging children from thinking that when things get difficult, they can throw exercise to the side because it's not as important as their academics or their work, or because we all do it. The work becomes difficult, we stop exercising. We have to study more, we stop exercising. It seems to me that's sending a wrong message. So is that something you're looking at? And secondly, what provisions do you have in place to deal with physical education as it impacts the physically and mentally challenged in society?
I will answer the first part, and I'll pass on the other one to Professor Conrad. What is actually happening at the school level, you know the curriculum is a packed curriculum. And every time we hear something that becomes topical, the cry is to get it on the curriculum. And there are only so many school contact hours we have and so many subject areas that we can treat with. Therefore, to deal with the span of subjects that are offered at the upper secondary level, which is CSEC, as we will say, there are over 30-something subject areas, not to mention the Caribbean vocational qualification subjects that are on the curriculum as well, that we have to put into that same school day or school week. And the subjects become optional. So in order to cater for children who are coming out of our education system and talking about qualification and certification to move forward, yeah, there's the option that they can choose which subject areas or which area of specialization they want to go, if I should put it that way. And therefore, you have some of them not choosing physical education as one of their programs of choice. But coupled with that, I would want to add that because physical education is a subject that is assessed at CXC at the ordinary level, and within the last year or two, it is now offered at the advanced level, we have students now subscribing to it because, I mean, and this is better than what it was before, when it was, as we acknowledge, it was assessed with just a participation grade and nothing else serious being done in terms of assessing physical education. Now it is assessed formally. It is seen as a formal subject on the curriculum. Children are now getting passes at the ordinary level and now pursuing it at A level. So there's that introduction at the upper school level in a formal sense. But in terms of how we can get physical education compulsory at the upper school level, again, it becomes a challenge because of the limited time and contact hours we have at the upper school level.
Chairman, I just want to go back to the nutrition and policy.
We have another question, there was part 2 to answer.
Oh, sorry, yes.
Okay,
After you answer your part B.
Thank you, Mr. Chair. The Ministry of Education is committed to recognizing the right to physical education for all its learners, including those with disabilities. However, we are impacted and influenced by the well-being and the physical health, the health of the students. So we have to be advised by medical practitioners, by our psychologists, etc., in terms of what we do. We articulate a very rich philosophy of inclusive practice, and we strive to ensure that during the use of adaptive physical education and encouraging our practitioners, our teachers, to take seriously the role of physical education activity with our students. We acknowledge that when we talk about, again, to make that point I referred to earlier about class, in that particular sense, I was talking about not the physical classroom space, but the context, the sense of the learning space of the typical school. So we have a lot going on in terms of articulating the inclusive curriculum, the sensitization and capacity building of our various teachers, and we are collaborating with the curriculum officers in PE to ensure that their officers are also benefiting from the options they have at the universities where they are doing physical education and adaptive physical education and bringing that into the school context. I will ask Mrs. Cupid as the Special Ed Coordinator if she has anything she'd like to add to that.
And I might add that in terms of special needs cohort, physical education and physical interaction is one of the most productive forms of engagement with that cohort in terms of their education and their psychosocial well-being.
Definitely, definitely. Endorse that. No issue with that at all. We definitely, not only that, but many of our learners who engage in physical activity, it ignites a passion for learning. It's about being valued, it's about self-esteem, it's about activities, endorphins, a lot of stuff that comes out from physical activity to the child, whether that child is wheelchair-bound, whether that child is blind, whether that child is hearing impaired. But I'll still like Mrs. Cupid to give the option of adding anything you would like to add to what I said.
Please.
Good morning, everyone. I would just like to endorse what Professor is saying and to move on. We are actively engaged in working with the curriculum department to ensure that those students who are identified, it is a challenge because our unit is a very small unit. However, we work collaboratively with the senior professionals through curriculum to ensure that those children who are identified with physical challenges, that their needs are met through the curriculum as well. So adaptive recommendations for differentiated instruction and how we really treat with including them in activities. So modifying the curriculum, modifying the activity, down to the activity level. We are more concerned with what actually happens to the child in the classroom. So the class is doing basketball, football, skills, whatever. There are skills that our children can be included, and we work with the curriculum department to ensure that that is happening as far as we can. There are challenges, we acknowledge that, where there is a reluctance in terms of attitudes. Generally, our society is not an inclusive society, so we have to, acknowledge that. And we work along with teachers very frequently to change their attitudes. And parents, there's a lot of resistance among the parents to have their children due to concerns of safety and their general lack of confidence that there are enough trained professionals to deal with their children and to avoid accidents, to avoid any damage to the child. So those are some of the challenges we have, but we are, as far as possible, trying to encourage that. As I just want to pick up on a point that Professor Conrad mentioned, that very often, not just our children with physical disabilities, but all our children who are challenged in any way, physical education is oftentimes the best avenue for them to express themselves and to avoid some of the mental health challenges such as depression, anxiety that we see so prevalent now in our nation's children because we are a very exam-oriented society. It's not just the problem of the Ministry of Education, it's the problem of our culture that we want high achievement and we want this. And therefore our children get that message, and that message is actually translated into the choices that they make in terms of subject choice, as Mr. Upshan was saying, in terms of subject choices and the fact that we put so much emphasis as parents on exams rather than on the well-being and health of our children from early childhood right through the school system. So I'll pause there to facilitate any further questions.
Just before we go to Member Hussain, I'm extremely heartened to hear someone speaking my language when it comes to special needs and special education, and the fact that we traditionally have not made a philosophical shift in understanding that the resources needed for special needs and children with learning disabilities needs to be expanded significantly, because we keep thinking that it is them or those children, as opposed to as wide as it really is in terms of an actual cohort that needs to be addressed. Member Hussain. So thank you very much.
Thank you, Chair. And going on that, I'm listening to both Professor and yourself. It comes back to the question that I'm about to pose to Mr. Doon, Dr. Doon. You indicated that equipment, this IDB loan would have been purchased a number of equipment for the primary schools. Does any of the equipment that have been sourced include for the specially who have special needs? Because you have, like, you could play cricket, but the ball has a sound so that the visually impaired can actually hear it. So I mean, are you considering equipment for the special needs child? And also, with this purchase of equipment, will all primary schools benefit or only government schools?
Well, it will be government schools as a start and government assisted, right? Government and government assisted. And in terms of whether there are special needs, I can't answer that, but the consultant worked alongside the Ministry of Education, physical education folks. So whether it's included or not, we could always check and verify that.
And Dr. Parasram, you spoke about a tax for the sugar, for sugar products, high content and so forth. Now there's a global thrust for this tax. Yeah. And I was wondering, I mean, our manufacturers sooner or later will not be able to penetrate the markets unless they reduce it. Yeah. Why not look at an incentive for our manufacturers to reduce it as opposed to a tax? Everything is always about, a tax. But if we look at an incentive, we can actually have our manufacturers given a head start on producing drinks and other products that are much more healthier and therefore be able to penetrate the markets out there in the very near future.
I believe implicit in the sugar-sweetened beverages policy, what we saw is that producers actually went ahead and actually dropped the actual content on their own, voluntarily through consultation with the Ministry of Health. So I wouldn't say it was an incentive per se, but it would have been something in terms of if they couldn't comply, they would not be able to sell to that market. So to maintain their market share, they would have had to comply with the policy. So in terms of that, there was that sort of, it wouldn't be an incentive, but we can definitely look into incentives as we go forward. The other bit we didn't get a chance to speak about was the nutritional labels that are ongoing and the nutritional standards, which Ms. Lewis could expound upon. Yeah.
If she could also expand upon the collaborations or the possible collaborations with the Ministry of Agriculture.
Sure.
And a possible Buy Local, Eat Healthy campaign.
Yes. Yeah.
Thank you very much, CMO and Chair. With respect to the participation of the Ministry of Agriculture, they actually were a member of the Nutrition Standards Working Committee, along with the Ministry of Education, who's here with us today, and the National School Dietary Services Limited, with wide participation from public sector, private sector, university, and civil society. So that working committee encompasses and comprises persons from Ministry of Agriculture. With respect to the Nutrition Standards Committee, we have worked to develop the standard that would improve the nutrition environment in school nutrition environments, to make it healthier school food environments. There was an agreement by CARICOM that was passed on to the government of Trinidad and Tobago, and when we had the last JSC on childhood obesity, that was raised, and we looked at the 6-point policy package that was approved by COTED and COSOD. The Ministry of Health engaged its partners, and we looked at the recommendations of that 6-point policy package and began the development of that nutrition standards. Where are we in this standard? One of the recommendations is that we adopt the PAHO nutrient profile model as the standard for assessing whether food or snack or drink should be offered for sale or served in schools. And we completed actually that process on the 7th of January this year, where we agreed that for all pre-packaged foods, we would utilize the PAHO nutrient profile model, and that would depend on the label. And there is, PAHO has, standards in terms of what should be allowed or not. So that's the recommendation going forth. And we are developing Trinidad and Tobago cutoffs for foods that are prepared. With respect to nutrition labeling, the ministry is also working on that. The Food Advisory Committee of the Chemistry, Food and Drugs Division has developed a draft policy, and the ministry is also looking at, COSQ, is working on finalizing nutrition labeling standards that the Ministry of Health will adopt. So we are working on both of them collaboratively.
And just before I go to Member Janice, because she has a different point, and I'm going to make us, because I did a lot of research before I came here today.
Mm-hmm.
It is one thing to have a labeling regime in place where nutritional value, sugar content and levels, etc., is placed on drinks. It's another thing to monitor and ensure that what is actually in the container
so sure.
is commensurate with what is on the label. Because what has been happening in some countries, the really forward-thinking countries like Sweden, etc., is that they test and they impose severe fines on people who flout those. Because let's not pretend, the reason the sugar is there is because it's addictive.
Yes.
Yeah.
So the manufacturers know, and I'm not demonizing the private sector, that the more sugar you put, the more likely the child will ask for that particular product. And it also goes, we're talking about sugar, but salt content in fast foods, which leads to cardiovascular disease later on. The more salt you put, the more addictive it becomes. So let's not think that this is a benign component of the foods that are proffered for sale. It is business at the expense, in many instances, of the health and well-being of our young people and our population at large. So if we're putting policies in place, we also need to put monitoring mechanisms to ensure that people comply with them and don't just feel because it's on the bottle that is so.
Right.
Right?
So,
Jennings.
Chair,
I have a question. I will give way.
Yeah, so no, I just wanted to finish the discussion on the labeling. Basically, in terms of the monitoring and evaluation, two divisions are really charged with it. One of Ministry of Health, Chemistry, Food and Drug Division is charged with monitoring.
Is that operational?
It is.
Fully?
The laboratory aspect of it, no, but we have been able to outsource.
So how are you testing if the lab is down?
We can outsource. We have been outsourcing the laboratory capacity through Kariri
and why is the lab down?
The lab had been down for a number of years. It's actually due to be back up and running within, I think, the first half of this year.
At what cost?
I don't have the cost offhand. But in terms of the labeling issue, in other territories, what they do is they do a label on the package that says no sugar, no salt, no triglycerides, no cholesterol. And that is in the form of a traffic sign. And that is cross-fuse standard, which is the Caribbean regional standard. That is what we are looking at to adopt in Trinidad, and maybe take it a little further. Instead of having is a black and white, no sugar, no salt, we're trying to get it to maybe a green if you have good levels and a red if you have bad levels. So we try to put in a visual cue to it.
And I don't want to belabor the point here, but very often what has been, the evidence is provided in the research papers that I've had a chance to read is that countries like Trinidad and Tobago are easy targets for international manufacturers who cannot stay in their own jurisdictions of origin. So they dump into developing countries at the expense of our population. So if the Food and Drug Lab is down, we have to outsource. How vigilant are we with those labels? And
well,
that is
I think the first thing is getting the standards in place. Without the standards, there's no standards to hold anyone to, even if you test. So the standard has to be there first. Once the standard is there, the testing part of it, even through CAFA has regional labs that we have utilized in the past in other territories in the Caribbean, and we can test through them while we await our lab to be up and running. So the vigilance at the market end is very important.
I have some questions. I have a question to pose to Ministry of Education, but from listening to you all this morning, I must say I'm very impressed with the level of collaboration and synchronization I'm seeing from the answers, so feel free, anyone could answer. Your submission as Ministry of Education submission, you indicated that the ministry intends to develop community-wide stakeholder involvement and a commitment to childhood obesity reduction. Given the eating habits of children at home, right? The eating habits at home also significantly affect a child's state of health. And I want to know what specific initiatives are the Ministry of Education pursuing to educate parents about health and wellness. I have two more questions, but I want the questions to be answered. Yeah.
Yes, ma'am. Chair, we've spoken a lot today about physical education.
That's right.
We need to look at the curriculum as a holistic offering to a student. All of the experiences that a child has and the attitudes and dispositions that are formed as a result of that. We have, as a ministry, when we think about the curriculum, the focus is on getting children to really think about their own selves, their own fitness and wellness, etc. And the curriculum fosters that. We have not as yet spoken about our HFLE curriculum, which has a huge component on eating and fitness. Parallel with that is a science curriculum, and from infancy all the way up, we have, I'll quote here from the actual curriculum, the infants, the babies discuss consequences of food and eating, not eating, and justify making healthy choices. So we're looking at forming habits from the early years throughout primary and secondary school. And if we take 7 years of primary and 3 years of secondary, we have 10 years of interacting with children and getting them to think about their own behaviors. The Phys Ed curriculum, which we spoke a lot about, didn't really present sufficiently, is really promoting fitness and wellness of the students. And we did not tell you all earlier that really it is a structured, organized program that is compulsory. And yes, Phys Ed happens across secondary and primary schools. And I want, therefore, to let the committee know that the content, it is a structured program, and the content you might be interested in, really, of the Phys Ed program, which really, the 6 themes that are mandatory, the body system. So they've got to understand themselves and their peers and how they are made. Healthy lifestyle practices, inclusive of responsible personal behaviors. Movement, because movement is so important. Sports skills and safety practices. That is also repeated in the science curriculum and in the HFLE curriculum. And we have not also, because we should really say it, the curriculum extends beyond this to actually the drama program, the dance program, even the strategies for teaching and learning across subjects and the interactivity that comes through that. So there is the whole focus, Chair, is on getting children to be aware of their...
That's wonderful and it's commendable, but what the member had asked is, you could teach the child all you want at home, particularly the primary level.
That's true.
When I get home, what mommy and daddy buy is what I have to eat. And all that will go down the drain because particularly in the lower socioeconomic demographics, they grab what they can. And you could say, well miss, in class, tell me that is not good for me, you better eat that.
And the child influences.
And that is the child, sorry?
And the child can influence the parents
No,
at the home.
let's be practical here.
Yes.
I mean, and that is a great utopian thought, but in most cases, the parent will say, eat that.
And
that's
Chair,
what I could afford.
And Chair, I was concerned as to the level of the parent-teacher's body. How, because we are talking about stakeholders, and the parent at home must be one of our highest stakeholders. What happens at home? What do they cook? Are they aware of how they could cook? What's important? What's not important? What affects the health of the child? And I asked the question. I spoke about community-wide stakeholder involvement, and I was very happy to hear that. But then I spoke to the educating of parents about health and wellness as it affects the child. What is the ministry doing about that? Because we already have a parent-teacher's body, a very active one, I dare say.
Honorable Member, through you, Chair, can I? On our board, we have a board of directors. The president of the national PTA, she sits. So the involvement, we basically meet the parents and we do some intervention. I'll ask my colleague to give some statistics on the amount of sessions and how much parents and teachers we've touched.
Right. For the fiscal year 2017-2018, we would have touched 1,506 parents, and this would be at PTA meetings and sometimes when they're affairs at the school. Most of the persons we would have touched would have been students, 7,678 students. Now, the challenge we have at PTA
just to be clear.
Yes.
What is the time frame and how many students?
So the time frame would have been October 2017 to September 2018. Those were the figures.
You were able to contact to have 1,506
1,506 parents, yes. And that would have been through your PTAs. The challenge again, and I know that would have been brought up.
And how many schools would that be?
In
Sorry to
all, there would
interrupt.
have been 66 schools throughout the 7 educational districts. Right. Very often, the sessions are done at the request of the schools. That's one. And it's a small unit. We have a manager and 2 nutrition officers, all qualified dietitians, who would spearhead these sessions, go to schools. I know the numbers are small, and part of it as well is the fact that you don't always have full participation of parents at PTAs. Very often when you go to PTA meetings, you're preaching to the converted. Those are the parents who come out and not always the ones that you would necessarily need to reach. But we do the request at the level of the school, and even though the school nutrition program, there are lists of students who qualify for the program, we do the sessions for all parents who turn up, who appear at the sessions.
That's a further question.
Sure.
Are principals mandated to organize sensitization exercises with parents and guardians with a view to improving their awareness about health and wellness?
That would have to be answered by the Ministry of Education, yes.
Principals are mandated to do what it takes to ensure that we have the child develop holistically and that they're healthy and happy. And therefore, this will incorporate a whole list of things which we didn't, or we haven't prescribed, so to speak. There's not a prescribed
So no.
list. Yeah.
So the answer is no.
Well, I'm not saying that mandated, but it is encouraged.
So the answer is no.
Yeah.
Member Amin was waiting a while.
Yes, thank you very much, Chairman. I was waiting a while, but I'm happy to see the discussions because apart from you, and this has to do with nutrition and your policies, you have had the opportunity to explain what actually happens in the school, but you give so much information on your policies. And I was happy for Mrs. Morton-Gittins' comments with regard to the holistic approach in terms of what is in the curriculum. But if you take your achievements so far with regards to sugar drinks, you made a decision to stop the sale of sugar drinks in the schools, and that in turn had a chain reaction. Parents become more aware because in some instances, they are less likely to give their children these drinks. The companies are now producing drinks with less sugar. And I am asking if you can take that a step further with regards to, for instance, snacks. Can we reach to the point where, as a policy, we must have a certain amount of fruits, for instance, for sale at the cafeteria? You must have other healthy snacks, as well as, particularly, I think, at the preschool level, where everything is in the lunch kit. Can we reach to the point where we make it a part of our policy approach that parents must provide a fruit in the lunch kit or something like that without infringing on people's right to choice, but make it a policy in the school just as we did with the soft drinks?
As we said in the opening remarks, when you had the JSC in December of 2016, one of the recommendations was to do just that. So after you turned to SSBs, we were going to look at unhealthy snacks, which was the second phase. And in terms of getting that policy ready, we're 90%, and I think we can look to the new school term in September as a date to implement the new policy going forward. So the first one, having gone through that, we already know what we need to put in place in terms of monitoring and evaluation. We would know how we do the stakeholder analysis, so a bit of the work would have been done beforehand. So I think the second policy will be a little bit easier to implement. Once we take away the unhealthy snacks, something has to replace it. So hopefully we can look to including in the policy, maybe not only through collaboration with agriculture, not only fruits that are in the bag, but fruits that are from Trinidad and Tobago as a policy.
I have a follow-up question before you leave that point. Have you ever thought of giving, like, to parents or your children at school, giving them a plan, a meal plan for a week, like what they can bring to school in their baskets or in their lunch kits? You see, I have been recently thrust into a position where I have to deal with somebody who is diabetic. And the biggest problem was to determine what we should eat, what we should cook. and in what quantities. And we are talking about obesity, and we are just hoping that somebody there would know what to do. But people out there don't know what to do. So that we have children coming to school, and if the same way we send letters to the parents to pay for some kind of a donation, for some kind of thing, it's the same way we can send slips of paper to assist the parent to, into how they can plan meals for their kids Monday to Friday and ensure that they have the correct nutritional balances and stuff like that. So did it ever come across that we had, or in your discussions, to do something like that?
So we already have something called the Healthy Reader, and Ms. Lewis could actually go into detail as to what we have developed already. All right?
Thank you very much, CMO, Chair, and members. We developed a healthy lifestyle reader for primary schools that speak to exactly what you're speaking about, and we also have a workbook. Again, this was developed collaboratively with Ministry of Education, NSDSL, who's here with us, CAFA, PAHO. What we did in 2018, we circulated that reader to all schools. I know it was interrupted in Victoria and St. Patrick because of the flooding, but it would have gone to between 350 and 400 schools. We also sent it as e-copies to a little less. So we have that reader. We have a school health education program called the Healthy Me School Health Education Program that is implemented with support from Ministry of Agriculture, NSDSL, the Nutrition and Metabolism Division, and we go to the schools where we focus specifically on healthy lifestyle education, healthy eating, active living, and we have included also growing a fruit or vegetable at home. So agriculture participates in that way. Along with that, one of the recommendations of the JSC in 2016 was the development of a parent education program. And we met with the NPTA. We felt that we would work with the National Parent Teachers Association. We met with them in 2017, and from about April 2017, we've engaged them. What we've done so far, we've done the sensitization of their various chapters, and they have assisted us in hosting meetings to parents in 7 education districts. We have not done Tobago. I will be transparent to say that. We have to get across to Tobago to that NPTA chapter. Further to that, in November of this year, we began the training of NGOs and CBOs as lay facilitators to take the message in terms of healthy lifestyles for prevention of NCDs and childhood obesity. NPTA participated in that. We did that with the support of the Pan American Health Organization. And right now we are waiting on the NPTA to submit their proposal. The next step is that the Ministry of Health, its partners, we would now support the implementation of that proposal, empowering the NPTA to be part of taking the message forward, because we know we alone can't do it, education alone can't do it. So we are engaging the NGOs to do that. So that's what we have done in terms of the parent education program that was mandated as a recommendation coming out of the Joint Select Committee.
Ms. Lewis, I could listen to you all, you have a beautiful voice. We're running short on time. I just want to get Member Ford and then Member Hussain, and we'll have some closing comments. Thank you so much.
According to your report, Ministry of Education, in September 2018, the school nutrition program, you all would have touched a total of 854 schools. Breakfast served 55,000 plus. Lunch served 81,000 plus. In terms of any findings with regards to student satisfaction, any survey done with regards to student satisfaction on the breakfast and meals provided?
Yes, Honorable Member, we have the findings of the survey. We did 5,000 children, and generally the findings are as follows. Consumption of meals was influenced by age group, with evidence showing better consumption patterns among the older age children for most food groups. Wastage for staple items such as rice, cassava, and paratha occurred amongst the younger age group. Vegetable consumption was the lowest among all items when observed by age group, and that includes the local vegetables, because we try to use as much local as possible. Students were generally satisfied with the overall taste of most meals provided. However, there was a preference for fast food type menus to be included more frequently on the menu when compared to that of our local, traditional, healthy meals. So those were the findings.
With regards to cost, you have an idea of what it cost for the 2017 to 2018 period? Total expenditure?
The expenditure for fiscal year 2016 to 17, we would have had $156.7 million. $10 million went into local agriculture. That's the measures that we have. This year we've been given $200 million, and basically that will cover our expenditure.
And again, from the PS point of view, money well spent?
Definitely. Sorry.
Yes, sir.
All right.
Well spent.
Right. I just wanted to change the topic slightly. And again, with regards to your report, page 11, right, in terms of, based on feedback received from principals, how is obesity connected to incidents of school violence and bullying in primary and secondary schools? Is there a correlation?
Or maybe student
Chair,
support services can also chime in.
Mr. Chair and Mr. Member, there is no reported case. There's been no reported cases linking obesity with incidents of school violence and bullying from principals.
So simply put, I'm a greedy guy, and I would like to bully a guy to get his meal. At all?
No reported, while we might be aware.
Even with anecdotal evidence, you're telling me that you have no reports.
You wanted to go high-tech.
No.
Bring it down to the
What I want to know is that I am Rubenesque, I am overweight, and nobody is teasing me.
Okay, all right. That's another point.
Nobody's teasing me, and you have no evidence of that. That is very impractical.
No, well, the statement asked about if we have received any feedback from principals. We don't have feedback from principals. I mean, we may be aware that this is we have to be alerted, but we have no data.
So I think I added to that. That's probably a line item we can include when we're doing our little survey.
Yes,
in terms of
the
point I mentioned, and also what the chairman has identified also from that point of view.
No reported.
I'm good, Mr. Chairman.
Thank you.
We take one more question from Member Hussain.
Thank you, Chair. Just going back to the school feeding. You spoke about a healthy radar. Is the school feeding program a part of this health radar committee? And also, what progress has been made into introducing the school nutrition program at the preschool level?
Thank you very much. I would speak to the Healthy Lifestyle Reader. Yes, the National Schools Dietary Services Limited has been a part, in fact, in developing it, and we have reached the stage. We did the first distribution, as I said, to about 350 to 400 schools. The PAEC also, they requested or recommended, mandated, one of those words, us to produce it and circulate to all schools. What we have done with support from the NSDSL, we have reviewed it and revised it. So we are at the point of getting funds for producing and sending it to schools, or as was suggested by Chair, Mr. Richards, we're also looking at sending it through social media.
Wait, just a sec. You said you're in the process of doing it.
No. This is a document. It was produced with support from NSDSL, education, agriculture, etc. It was printed. It was utilized as the basis for our school health education on healthy lifestyle and healthy nutrition. We utilize the National Primary School Nutrition Quiz to assess children's understanding of the information and content, and that was very successfully held. And we are at the point now where we are revising it because we want to strengthen certain components. For instance, reading food labels, beginning from young to teach them to do this, issues around sugar-sweetened beverages, etc. So what we have done in 2018, we completed a revision. So there would be, if you could say, a second edition coming up. And this is the point at which we've completed that revision now. So the point that we're at is producing the new version, and then that would be distributed either hard copy or sent in via e-methods to schools. Thank you.
All right, just one quick question from me to the Chief Medical Officer. It may not be related, but I saw it come up in one of the documents you sent. How concerned are you about the unregulated level of energy drinks, particularly in secondary schools?
It's regulated, now we ban it.
Well, it's not unregulated anymore in terms of the policy. So as of September 2017, it is included in terms of the policy, but we were very concerned prior to that.
All right, thank you. All right, I'm just going to open the floor for the Chief Medical Officer and the Acting Permanent Secretary in the Ministry to make closing comments, please.
So, Mr. Chair, members of the committee and colleagues, thank you for the questions and feedback. Our team at the Ministry of Health will continue to collaborate with key stakeholders, including the Ministry of Education, towards promoting a healthy environment for children with supporting programs and initiatives, both at schools and in their homes. Thank you.
And
thank you, Chair and members. The Ministry of Education, we at the Ministry of Education and the team that is represented here, we note your concerns, and we note that the emphasis is that the Ministry of Education must move away from policy and look more at implementation and monitoring and ensuring that what the outcomes that we have identified are in fact being realized. But the Ministry also recognizes that if we have started an initiative or policy in 2017, impact is not going to be noticeable until around probably 5 to 8 years. But we recognize, and the questions that were being asked, is it happening? And the Ministry, we would be able to, next rounds, and we'll be revisiting in that we should know definitively that physical education is taking place, or children are participating, that in fact there are no, if we said there are no to be no sweetened drinks, that they are not available, and in fact that our parents are involved. I think coming out of it, those are the messages that we will take and seek to put in place.
All right. Thank you. For my part, I want to commend you both for what is no doubt an excellent relationship and collaboration between both ministries. We've had many people come before many committees before, and this level of organic communication is extremely commendable because you seem to be on the same page in terms of your collaborative effort. I hope the Ministry of Agriculture is as involved. I know it was indicated there at the committee level, but certainly in terms of providing the alternatives that are locally grown, it's going to be an addition. My suggestions and concerns come with understanding that we sell parties and we sell entertainment and we sell foods, but we don't sell mindsets as effectively. We don't sell themes. Many, many years ago in our generation, there was a Buy Local campaign that was very, very successful. There was a Chase Charlie Away campaign that was very, very successful nationally. And we need to tap into that sort of national paradigm shift through very creative themes and advertising, not through posters, but through social media and digital platforms where the target audience in terms of children and their parents and families and communities basically reside and communicate these days. If you look at any of the research papers coming out, 85% of communication in the poorest countries in the world, 85% is through WhatsApp, digital means. So if we're still at posters, we missed the boat. And not only that, it's cost effective and you can make it consistent. WhatsApp group between a teacher and parents to disseminate, as Member Amin and others have suggested, dietary plans and meal plans. It is not about paper anymore. It is instantaneous digital communication and consistent messaging that will augment and support the policies that you are extremely well versed in, but my concern is the practical application and measurement on the ground. And that's not to say I don't think that you're making significant progress, because you certainly are. But we have to take it to them, the population, in areas and domains where they reside, which is the digital domain, to make the effect. And I'm really concerned about the monitoring of the sugar levels in the juices, and hoping that, as you suggested, Chief Medical Officer said, that the lab is up and running, because that is also a significant component. So on behalf of the committee, we'd like to thank you very much for being with us here today and for being so well researched and prepared, and again for your collaboration in the interest of the children and people of Trinidad and Tobago. And we would like to thank our viewing and listening audience and those who have been watching online at ParlView. We're going to suspend, and we will have a short meeting afterwards. Thank you so much.